this session for those who can't make it or for you to rewatch this later. Recordings will be available for up to 30 days from when we put it up. We are also pinning the video so that only the panelists will be recorded. This means that you can choose to keep your video and audio on or off. If you speak, the recording will pick up your audio but not your name. You can type your questions in the chat box if you prefer, and you can also private message me if you have any questions but you are shy to ask directly, and I'll make a note and we will address it during Q&A at the end. Also, please keep your audio mute whenever you are not speaking, otherwise we might pick up your background noise. We also encourage you to check our Sugar and Spice Facebook group for latest updates and announcements. Next, some important messages. Consent. Please do not contact other participants outside of the festival without their consent. You can always ask them for permission through the festival or Facebook group before messaging them. We do not want instances of participants feeling violated or unsafe. Anytime during the panel or at the end of the panel, if you need emotional support, you can email us at emotionalsupport@sugarandspice.asia. Okay, so let me just introduce the moderator for this session. It's Dr. Rica Cruz. Dr. Rica Cruz is a psychologist, sex and relationship therapist, and a faculty member of the Department of Psychology at the Ateneo de Manila University. I'm not sure if I got that right.
It's okay.
It's okay. She has a PhD in psychology and had further training and certifications in sex and relationship therapy from the University of Guelph, Cambridge Alliance Harvard Medical School, and the Society for Scientific Study of Sexuality. Her expertise is focused on Filipino sexual behaviors and sexual pleasure, and her practice revolves around individuals and couples with sexual and relationship and marital issues. As a sex therapist, researcher, educator, and lover, she opines that Filipino sexual ownership and empowerment is sexier than sex. So I'll just pass it over to Dr. Rica Cruz.
Thank you so much, Yuwen, for that wonderful introduction. And thank you so much for the Sugar and Spice Festival for allowing me to moderate this discussion. Okay, and this discussion, I know that everyone here knows that this is about vaginismus. We're going to talk about different experiences with vaginismus and how we can get through it, what we can do about it, and what else moving forward can we know about it. But of course, before I start, I want everyone to be on the same page in terms of the definition of vaginismus. And we have Dr. Martha to tell us more about what vaginismus really is. Dr. Martha?
Thank you. Thank you, Dr. Rica. So my name is Martha. I am a relationship counselor and clinical sexologist. I have been in practice for 12 years now, and I specialize in working with clients with vaginismus or unconsummated marriage. When I was studying my doctorate in human sexuality and first found out about vaginismus, I was really devastated, and I can't imagine how a person who has vaginismus will feel like. And so I was very surprised when I started my practice that I actually started to have a lot of clients with vaginismus come to me. And in the first 2 years of my practice, I had already worked with more than 200 people with vaginismus, and it has been 12 years. So what is vaginismus? It's a condition that happens when a person who has a vagina, the vagina shuts down, making penetration difficult or impossible. And by shut down, what we mean is that the pelvic floor muscles, the vaginal muscles tenses up, making penetration difficult or impossible. And from time to time, it can happen that other objects are possible, like finger or a bullet vibrator, but not the penis. So this has to be linked to the association with the attitude and the fear around the penis. So a lot of people ask about whether vaginismus is physical. it is written that it's psychological. So the mind actually causes the body to tense up. And then the pelvic floor muscle tenses up, making penetration difficult and painful. And so a lot of my clients think they have vaginismus, but actually what they are having is they are just having sensitivity around their genitals because they are also virgins. So most of my clients with vaginismus, more than 90% of them are primary vaginismus. Most of them are virgins. Most of them only find out that they have vaginismus after their marriage. And so this can happen on the day of their wedding and a month after. So it wasn't unusual for most of the time for my practice, for lots of couples to come in saying that we haven't been able to consummate our marriage. It's been 2 years, it's been 3 years, and we are so ready to have a kid. And so their motivation of coming to see me is the kid and not really about overcoming vaginismus or enjoying sex. So besides working with clients to give them what they want and focus on the goals that they have to overcome vaginismus, I also really feel it's so important to also talk about the importance and the pleasure that is possible with sex and touch and intimacy. And so this is vaginismus in a nutshell. Yeah, it's very much the mind, and it's very much linked to the fear of pain, and very much linked to the fear of the unknown. Because a lot of them have primary vaginismus, they don't know what to expect, they don't know what's going to happen, and when they feel any kind of discomfort, tingling, pain, discomfort, they freak out and they think it's not normal. And because there's not a lot of resources about first-time sex or virginity or vaginismus, they don't know what to do. And unfortunately, because I work with so many clients with vaginismus, I actually do look online about what is available about vaginismus cure, and a lot of it is very, very cliche, and there's a lot of pain and shame that people with vaginismus have when they go to a doctor, because a medical doctor will just say, okay, just spread your legs, and they will just immediately do a physical examination. And so it can be very traumatizing for them to be shamed and to be told, oh, you should just relax, or just take some wine, or here's some lidocaine, which is basically a numbing gel, and things like that. So they are not really treated in a way that feels honoring and respectful of their body, especially when there's already so much difficulties around even talking about the topic of sex for a lot of them, being Asians, I being Asian myself. Yeah. So anyway, I'll just pass it on to the next person.
Yeah, thank you, Dr. Martha, for that wonderful definition and that wonderful introduction of yourself. Dr. Martha is our first panelist, and like what she said, she's a therapist and based in Singapore, and she works with couples, individuals, and couples too. Especially right now, what she's telling us is working with couples who have experienced vaginismus. And what she's saying is that vaginismus is the body's automatic reaction when the vagina tenses up, and usually it's because of fear, fear of some kind of vaginal penetration or the penis itself. So thank you, Dr. Martha, for that wonderful introduction of yourself. So we will move on to our second panelist, and our second panelist is Ruoshi. Ruoshi, did I say that correctly? Hi,
Yes.
Ruoshi. Could you please introduce yourself to us and our viewers and our listeners here?
Okay, I'm Ruoshi, or Ruoshi, you can call me. I'm an artist, and I have been a vaginismus sufferer, but right now I'm quite okay already. After giving birth to 4 kids, yeah, occasionally it will still come back, but it's not as bad as before. So yes, I went through the very difficult time. Yes.
You went through a very difficult and challenging time because you experienced vaginismus before. Though you're saying that sometimes it still comes and goes. Am I correct?
Yes, but at least at this, after so many years, I am able to condition myself to relax, and very soon I'm okay, because it comes back sometimes when during my pap smear, and then I think sometimes it's the environment also sort of like quite intimidating at times.
Yeah.
So but after so many years, and also I have been able to have intercourse with my husband. So I'm able to condition myself to overcome it when it suddenly pops up. Yes.
So now you're able to manage it better than before.
Yes. That's right.
Thank you.
Right.
We'll talk about that more later. I'll ask you more about your experiences and how you were able to get through it. And thank you. This is Ruoshi, our second panelist, and our third panelist is Hanee. Hanee, I know that you have a background in physiotherapy. Can you tell us more about that, and can you please introduce yourself to us?
Okay, thank you. Hello, everyone. I am Hanee, working as pelvic floor physiotherapist at Vibrance Pelvic Health Center in Malaysia. And I used to help patients, women with pelvic floor dysfunction case, such as urine leakage, pelvic organ prolapse, abdominal separation after pregnancy, and I also providing rehab for vaginismus and dyspareunia. And thank you for giving me the opportunity to be the panelist tonight. And aside from being a Kegel advocate in Malaysia, I really passionate to educate more women about the importance of sexual health. And vaginismus is real condition and it's very possible to cure and possible to heal. Okay.
So you're here to tell us that it is possible that you can overcome vaginismus. You help women with vaginismus through physiotherapy.
Yes.
Thank you. Okay, we'll get to that again. I'll ask you questions, but now I want to go back to Ruoshi. Ruoshi, I want to know, like, your experiences with vaginismus. How did it affect your relationship? You said that you had you now have 4 kids, but
yes,
of course before, when you were going through it, how was that for you and your husband?
Okay, first of all, I need to clarify that actually my 4th child is with my second husband. So I have to give credit to my ex-husband, who has been very understanding when I actually first discovered this condition. Yes. So what do you call it? It has been a kind of a long process, dated since early adulthood. Yeah. So at the time, my courtship with the then boyfriend was good until because I came from a traditional family. So when I have my first sexual experience with him, I am kind of like how to say it, a bit guilty, because I haven't got married with him, and then we try sex before marriage. So I think psychologically it does affect, and I realized that it was so difficult for him to do the penetration, and then. But I thought, it's kind of a common thing, because coming from a traditional family, my mom, she don't like to talk about sexual intercourse. She don't want to educate us on that part. Yeah, for fear that maybe we want to experience it before marriage. But I think that kind of like not doing any help for me, because when I experienced this condition, it kind of like make me feel very inconfident. I have a very low self-esteem. Yeah.
How old were you when you discovered that you have vaginismus or you experienced
Uh,
vaginismus?
I think it was around 20 years old, 20, 21 years old.
Mm-hmm.
Yes. So because
And,
that was yes, that was with my the then boyfriend. But later on we got married. Yeah. And over the years we got married when I was at the age of 23. But I
mm-hmm.
only managed to have my I only managed to have my first child at the age of 30 plus. Yeah. So
So you got married at the age of 23, and you were able to have your child uh after a couple of years or more, after around almost a
about
decade.
7 years. About seven
Yeah.
years. Okay, even then, my first child came as I would call it a gift because I never think that I would even got pregnant, because we at the time when we were trying for a baby, of course me and my ex-husband already know about my condition, but
Mm-hmm.
we wanted to try to have a child. So
Mm-hmm.
he didn't really do the penetration. He just ejaculate at the at the
The
outside.
opening, yeah, the
That's
opening of the
And
vagina.
then
Yes.
he used the fingering, and then I just conceived.
Oh,
So
so there wasn't penetration involved. There wasn't penile penetration involved.
no,
Okay.
not
And you were together for 7 years, 8 years before you were able to conceive. And during that 7 to 8 years, am I hearing
yes.
that you didn't have any kind of penile vaginal penetration?
That's right. It's kind of like I try to pleasure him with other ways, and
Mm-hmm.
we just do the rubbing of the exterior of it, exterior
Mm-hmm.
of my vagina. So it's not no penetration done, because each time when he try penetration, I would be like I will go hysterical.
Oh,
Yes,
you
and
will get angry. Yeah.
yes, I will get really anxious, and my thighs were really tight, and I cannot I cannot relax at all. I was like so tense up that it's even impossible to open up my legs. It's that bad.
Mm-hmm.
Yeah. So
Okay.
I remember also there's one incident where I experienced a large amount of period. So
Mm-hmm.
I concerned. So I went to my sister's the clinic, the gynecology where she used to work as a nurse, and then her boss, the doctor, actually do the pap smear for me. But that was like
Mm-hmm.
so impossible to do. And after the pap smear, I was really pain, and even bring my esteem level down furthermore.
Yeah, because it hurt you. I thank you for that, Roshi. I want to ask Dr. Martha and Hani if you've ever had clients, or if you've ever worked with women who had the same story as Roshi, that not being able to experience penile vaginal penetration for 7, 8 years.
Yes, I have clients who have had vaginismus for up to 15 years, a handful,
Mhm.
10 years, and many 2 years. So I'm always very happy when they come in earlier, before marriage, for those who identify as heterosexuals. And so yeah, I think the people who are the most hopeful and willing to do the exercises and who are determined to overcome the condition tend to be the people who come earlier. The longer it
Mhm.
drags on, the more it affects their self-esteem and confidence and willingness to try. So yeah,
Mhm. Like what happened with Roshi.
yeah. So
She
15
did
years,
say
15
that.
years is the record. Yeah.
Yeah. Yeah, so you would tell women to come in at an early an early time and not let it like go long up until 15 years. How about you, Hani? Were you able to work with women the same experience?
Yes, I have a sub patient with the kind of 7 years marriage, maybe earlier than that, 3 years marriage. But most of them, yes, maybe because they didn't know how to seek help, and maybe didn't know the place that have a proper guidance to help them, and they just clueless about that vaginismus. And maybe certain of them, they went to for gynae checkup, and maybe the condition is not fully addressed, and maybe they didn't understand about their condition, didn't share with their husband itself, didn't share with the doctor very specific, and then they come with us for physiotherapy. I said, Dr. Martha said, and it's really encourage them to come earlier. And I also trust for vaginismus management, it's require combination of education, physiotherapy, psychotherapy. It's not, sometimes I have patients that have concept that they just think they just issue they think they just have issue with physical things, but actually when we analyze their condition, they also have psychological issue, meaning sometimes like emotional disturbance, stress, depression, because maybe long time to survive with the vaginismus alone. So yes, I really like agree that for vaginismus treatment is require combination for physical therapy and also sexual therapy, and also education is very important, and all this must involve the partner also.
Yeah. So what you're saying is that for treatment of vaginismus, you believe that it should be holistic. There's
Yes.
some education, there's physical therapy, there's physiotherapy, there's psychotherapy, and also it helps if the partner is involved in the treatment. So I want to go back to Ruoshi, and I want to go back to Ruoshi, and I will ask you something later. I just want to know, during those 7 years and you being able to conceive and you saying that you were able to manage your vaginismus, what was your partner's role in it?
I think for the first 7 years of marriage, there were a lot of, how to say it? It's like, we have a lot of argument. So in a way, it's not that he is being out of patience of me. He's just, very concerned that we will not be able to have kids. So I think he also didn't realize that it was so bad. So he didn't even know what is the name of this condition. Both of us, we were in at that time was like late 90s, and I don't even have chance to have people like Martha whom I can seek help from. You see, so it's really until the end of the 7 years, and it was during the SARS period that we really realized that what is more important in our lives. So he and we decided to like try to overcome it, and we really get it started by we really try to relax, try to do exercises. We call it the finger exercise. So maybe first start with a bit of the one finger, then slowly add on to the full finger, and then add on to one more finger, and so on. Yes.
Okay, until you were able to have that penile penetration.
Okay, so when we had the exercises, I still not able to have that penile penetration. That is when we try the, that take a chance away, like really ejaculate outside and then push using the finger and see what will happen. And truly I conceived. So when I conceived, I was really happy. I was like having although with the morning sickness and things like that, I was enjoying my pregnancy until the end, when my doctor was trying to see whether my cervix will open. That was the time when this condition comes back again, reminding me that, hey, you still have this condition you have not tackled, you know. And then my gynae then was very shocked. She didn't, how to say it? She didn't understand how we can actually got pregnant when I have such a serious condition here. Yeah, talking about really serious condition in the vaginismus. Yeah. So so at that time she was like trying to you know, tell me to, why not you do a elective cesarean. And then I was actually trying for natural birth. In the end, after 20 over hours, all sorts of condition telling me that I have to go for a cesarean. So I was kind of beaten, to be honest. I probably even have those postnatal blues of not having to go through a vaginal birth. So after which, when I, before I conceived my second one, I noticed that my condition seemingly improved.
Oh, okay.
Yeah.
So after you gave birth, it felt that your condition improved. Like, how were you able to notice that?
Okay, because I think when they were doing the, you know, when I was trying to do the natural birth, I actually went through induction. So, sorry, so when the induction happens, they have to put pessaries inside. So they have to see the cervix with how much is open. Then I go through a hell of all those things, and then, you know, and the nurses would be like having a hell of a time treating me. Then would be like asking me to relax and things like that. You know, all sorts of ways, asking me to cough, asking me to, you know, relax.
Yeah, it's the same thing that Dr. Martha was saying a while ago when
yeah,
they just tell you to relax.
Yeah, so I think after the, you know, after giving birth to my son, there was the time where I realized that, hey, I'm already a mother of one. I should really look into this matter and try to solve this problem. Otherwise, I cannot always depend on luck that, you know, the ejaculation has been outside. I'm lucky once. I cannot be lucky all the time. Yeah.
That's true. Thank you for that story. Dr. Martha, do you have any thoughts on how Ruoshi was able to say that her conditions improved after she gave birth?
Yeah, I've known her for many years. So I think what happens with a lot of my clients with vaginismus is that because we don't touch ourselves internally or vaginally with our own fingers, being vagina owners, one of the big fears is that we will hurt ourselves, we will cut ourselves with our nails, and we cannot see. So when you have had treatment on yourself, like the pessary that she's talking about, what happens also is the sensitivity of the vagina starts to be less sensitive. So I like to call it the vaginal muscles become stronger with exposure, with time, with massage. And so when the sensitivity is less and the connection is more with the body, then there's this sense of reclaiming your body. And hopefully the vaginismus, this is what she means. I think she means that it seems like it's less severe, like there's less fear. So there's this process of, doctors call it this, which is a progress of desensitization. Yeah.
Okay, so that's what you think happened to her. She went through desensitization, and it, for her condition seemingly improved. Though I know, Dr. Martha, is that one way to treat vaginismus? Is that one way that you go about your clients with vaginismus, through desensitization? Are there other ways?
Yes, yes. So I do what Hanee does also. I focus on the sex education. The first session I already explained about anatomy and how the vagina works and what kind of pain to expect. I think a lot of them expect no sensation, no pain. because the penis seems to glide in porn. And so they assume as long as there's the mood, as long as they're aroused, then there shouldn't be any like difficulties because of what they see in porn, without understanding that these people in porn, they are performers and they are very, very comfortable with their bodies. So I call them the sex Olympians. And it's very difficult to compare yourself against them when you are actually experiencing this for the first time. So I explain how what pain to expect in the vagina, and also the structure. The first 1/3 of the vagina being the most sensitive, and the neck of the vagina being more narrow, and how there's a curvature, and how to insert with the finger if they want to use a finger. So a lot of the first session is really about just answering their questions and meeting them where they're at, because I can have a structure and I can have a flow. But until they get to feel that they get all their questions answered and they have an idea that I do know what I'm talking about and where they can go, then they are more willing to talk further about what kind of exercises to do to overcome vaginismus quicker.
At this point, Dr. Cruz just wanted to tell you it's 30 minutes.
Oh, okay. Thank you so much, Yuwen. All right. Thank you. Hanee, how about you? Are there other ways that you go about or treat vaginismus? I know Dr. Martha said that she first starts with education. How about you? What do you do?
Yeah, as my practice at Malaysia, so actually in our center, we have in-house sexologists and I'm as physiotherapist. So usually we will meet the patient at the same time with the sexologist. So usually sexologist will consult with education, but me more tackling about the physical challenges. So usually maybe I just share a bit what usually I do. First, we do the assessment, we do the vaginal examination to rule out any gynecological issue, because I have experienced that I found patients that actually have vaginal stenosis. It's actually a condition where the vaginal canal is very narrow and it's not about muscle tightness, it's not about muscle spasm, but actually the anatomical of the structure is really narrow. So I refer back her to the gynae, and she did the surgery, and then after the surgery, after the widening the canal, and she came to me back to do the rehab. So we started the vaginismus rehab management. So since, because I know it's a very structural challenges, but after the surgery they still have fear, still have anxiety of the penetration, so she unable to get the penetration. So that's why I started the vaginismus treatment. And other than that, actually we also provide we also teach breathing exercise, stretching exercise, because we know when penetration want to happen, all these clients, they feel like very fear and very like automatic have a protective feedback mechanism. They have like auto clench their leg, auto lift up their buttock. So what we actually aim to do, we want to do the rehab, we want to do the repetition, we want to do the stretching, we want to flexible the muscle tone, so that they will more familiar with the activity that we can do with the vagina area. So not just education, we also help them to guide them to use dilator, so they more familiar what is actually sensation. And actually because they don't familiar with all the sensation, that's why they very fear about it. So the rehab is intent to give their sensation, so that they can expect, oh, this is not so painful, it's very tolerable. So that's why we really guide during the physical session.
Thank you so much. Hanee, I have a question though.
Yep.
You did say that these women are scared, right? They're scared to have something inside of them or penetrate them. So how do you do it? How do you go about their fears? How do you get to touch them or to make them experience the sensation that you're saying?
Yeah, usually for vaginismus patient, they have some concept that they don't want to touch their vulva, they don't want to touch the vagina. So even they very fear to have to look their own vagina. So what actually the syllabus in my physiotherapy rehab approach. So basically we start with self-exploration. I know sometimes for especially for Muslim, right? They really like sensitive about all these things. They might think it's actually masturbation, honey. So actually it's not. We really encourage that all these patients started with self-exploration, because only when we trust our body, and then we trust our partner to touch us. Okay, so that's usually we educate the concept about when we need to tackle the fear of pain. So that's why we really like relate back about the arousal, about the lubrication, about the desire. So even they really like practice with the dilator, right? So very committed to do the physical training, but they don't relate with all the psychological factor. For example, like desire, arousal. So they didn't apply that. So it's actually very challenging to cure, to recover. So that's why during the treatment we still tackle the fear of pain, but educating the concept that actually they need to have a very clear concept about the desire, the arousal, and all lubrication. Because only when the vagina is really like have wetting, have enough lubrication, the vagina is very dilated. And I used to share with my client that, hey, you can imagine how very big size of the baby head it can come out from a vagina. So sometimes it's very like they just need support, they need the emotional encouragement. So yeah, I can see that in my patient, if really like giving a very strong support, they actually can go in the right track.
So you provide them with enough support so that they can overcome the fear that they are experiencing. How about you, Dr. Martha? I know that you have your different steps of treatment when it comes to vaginismus. Can you share with us that treatment of yours that you were able to come up with in all these years of treating women with vaginismus?
Yes, thank you for asking. So when I was training to be a sexologist, the literature for vaginismus is really very limited and actually very terrible. They just talk about dilators and that's it. And they talk about progressive and that's it. They don't talk about the importance of arousal with the dilators. They don't talk about how to use the dilators. It's very, very vague. So very soon I realized that what I learned in sex school is not useful for clients with vaginismus because they are having a phobia. And so what I started to do was I brought in what was useful when I was a virgin and what I did with my partner. And I was very, very surprised that it worked very, very well with my clients, and several of them very quickly overcame vaginismus, some of them in one session, some of them in 2 sessions. And so I call it Martha's formula because there was no name for it. So essentially, in Martha's formula, I get my clients to, I have to explain a few things to them. So for instance, if they don't know how to masturbate, if they don't know how they have an orgasm, if they don't know the parts of their genitals, if they don't know where's the clit, like all these things I need to explain to them. Beyond that, Martha's formula is, I call it 2 or 3 cycles of arousal. So you arouse, you arouse yourself if you can get an orgasm, and then you start practicing inserting in the smallest way, finger. And then when you feel pain, aching, fear, any of these, dryness, then you can stop for a while, rest, take a break, and then try again. So the cycle is such that you try one time, and then you are scared or in pain, you stop, and then try again, stop and try again. So it's this stop-start, which also is what we teach clients with premature ejaculation. But this was what I went through with my partner. So 2-3 cycles per session, and every session between 30 to 60 minutes, because it does take time to go through the cycles of arousal, and it also takes time to relax and drop into your body, and then also to practice regularly. So I noticed that because of the lack of privacy, me and my partner was doing practicing like once a week. So he will arouse me, and then we'll try with finger, and then that's the limit. We'll stop for a while, we'll try again, we'll stop for a while, we'll try again. So this stop start. And I noticed that when it was once a week, the progress was like that. And then when we were able to do it twice a week, suddenly the progress was much was much more, as in I was able to be comfortable more quickly to insert the finger. So this is what we call the muscle memory, like the body actually was learning something, and the stimulation of the entrance of the vagina actually helped the vagina to become stronger and also to be less sensitive over time. So this is something that I teach, and it's my signature thing, and was very, very effective, because I had so much fear. I couldn't touch myself, and I didn't have vaginismus, and I was very lucky that the person that I was with was very supportive and encouraging, and said all the right things, and was very loving. And so I was able to do all the practices with my partner, and it wasn't stressful. There was no blaming, there was no shaming. And I can only imagine how difficult it is for my clients who are experiencing that from their partners.
Thank you so much for sharing that with us, Dr. Martha. I learned so much just from listening to you. But one of the things that I really loved about what you said is that you were lucky that your partner was there for you, and he was very, very supportive, and he didn't shame you nor judge you for what you were experiencing. Instead, he was there to help you practice and do that whole cycle and muscle memory thing for you to overcome what you were experiencing, for you to overcome the fear and the pain. And now you're sharing it with everyone and all your clients. So thank you.
Yes.
Thank
so
you
I just want to add, I just want to add that the time of the practices with my partner, I call it my deflowering process, was one of the sweetest time in my life. It really made me feel so loved and so positive about my body and about my sexuality. And it is actually because of that allowed me to feel that sex is an important part of our lives. And then because of the confidence, decide to be a sexologist, because I feel it is an important part of being human. And that actually was the foundation of everything subsequently for my life. So I can only imagine how bad and how terrible and how wrong it can feel for people who start off with trauma, with sexual assault, with painful sex.
Yeah, and I'm sure that you're able to work with them to get over those fears and, of course, those trauma. Thank you so much, Dr. Martha. All right. Maybe because we are running out of time and we still have a lot of questions to tackle, I want to ask each one of our panelists, like, what their advice to women is or are, if you have a lot of tips and tricks to share, especially those who are experiencing vaginismus, and those who went through a very hard time, say with their partners, who maybe have partners who's shaming them, who's judging them. So I'll give you the floor and just say whatever you want and share with us whatever you want. Maybe we can start with Ruoshi.
I think, first of all, okay, because I am speaking based on my experience, for those who come from a traditional background, okay, I think you should not feel ashamed, or you should not have that low self-esteem that it doesn't work out, in the beginning, because I think it's all about the learning part and how you condition yourself, how you, what is your purpose, to get through this condition that you're experiencing. Like for my case, I wanted to have kids. I wanted to have a good relationship with my husband. So this pushes me towards solving this problem of mine. And with perseverance, everyone can solve that problem. Yeah.
Thank you. So they have to be motivated and to persevere, that they would want to overcome this experience, because they deserve to enjoy sex as well.
Yes,
thank you so much, Ruoshi. How about you, Hanee? what could you say for other women who experience vaginismus?
Yeah, I would say that please don't suffer in silence. Try to reach out all the professional help, because with the professional guidance, okay, it will help you in the right track. Because I have patients that actually try to do a lot of uh a lot of advices, a lot of suggestion from the Google, but actually it's worsening the tightness of the muscle. For example, they do Kegel without guidance. So actually we are here to help, and maybe unable to get with us because maybe a different country. But yes, we offer online consultation. So try your best to reach out us, and we also can help you in order to get a better outcome.
So it's really telling these women that there's help, and that they can overcome it with help and support from other women as well, such as you, Hanee. And Dr. Martha, do you have any advice to women who would want to see you for treatment for their vaginismus, or maybe those who are scared to see a professional? What can you tell them?
Yeah, what I find with a lot of my clients is that they may be trying, and yet they are only trying in the same way. So doing the same way many times is not really helpful. Then please, people who specialize in this, so really find people who are specialized in this, who can help you to save time and energy, because there are people who, when time goes on for too long, there are other consequences that can happen, like it can lead to communication breakdown, and it could lead to separation, breakup, divorce, infidelity. I've seen all these. So whenever I meet with a client, I really do my best to help them in as short a time as possible. However, I do understand that it is not linear for everybody. It's not just one straight line. I wish, I can just press a button and I can fix everybody. I really, it's really devastating to hear it when they are going through such heartache and emotional, and also a lot of self-blame and all these other things. Yeah, so what I would say is really be very clear in looking for people who really know what they're doing. Do your research, and people who specialize in vaginismus will say that, and don't end up being a guinea pig for people who are not very experienced but think that they just want to try.
Yeah, thank you for that. Yeah, because that can be very dangerous. It can do more harm than good. So it's important that we tell these people to find someone who has an expertise on vaginismus to help them, because it takes a lot of training and a lot of knowledge on that topic to be able to help others as well. Thank you so much to our panelists, but don't go yet. I know we have a lot of questions to tackle. I just want to say hello to all our participants, and I know that we have other experts here as well. I know that we have Jacqueline from the Netherlands and Katrin from Canada. Hello, are you here?
Yes, I'm here. I'm Jacqueline from the Netherlands.
Hi, Jacqueline, and hi, Katrin. Yeah, thank you for listening and joining us here in our panel. I want to ask you if you have any advice or any thoughts on what we've discussed during this panel. Maybe we can start with Jacqueline. Yeah.
I think it's really nice that this panel is here. Because talking about vaginismus for a lot of people is not so common. And vaginismus is my own experience. I overcome it. So when I hear the story of Ruoshi, I recognize so many things about it. For myself, I went a really shameful, lonely, difficult road with lots of guidance from people who didn't really know and understand what I need. When I try to ask some questions, to them, for example, how to let my finger go into my vagina, they say it's really easy. You just put your finger inside your vagina. And the only thing I thought was, yes, how? And maybe I'm so stupid because I don't know how. So I think this talk, what you about this is the reason why I become a vaginismus specialist is because of this, is because of so many not so good guidance. And when I talked to Marta for about 2 months ago, we talked about how treatments and how similar our treatments are and how important it is. And for me, the most important thing is that so many women put the steps they want to take much too big. And when the steps or the exercises you want to do are too big, then the fear is too big. And then most of all, you don't do it. You don't dare to do it. You don't know how to do it. So you have to find some guidance with special detailed techniques and special knowledge that you know how to do a step. And when you do the step, I think curiosity is really important, because when you are curious about the step and about the results, then you have more than the chance that you do the exercise is better. And I think this is great that you talk about this kind of thing.
Thank you so much, Jacqueline, for that. I love what you said when you said that curiosity is very, very important for women to know or to want to know more what's going to happen after the second step, after the first step, second step, third step, so that they can push forward and overcome the fear and the pain that you yourself experienced as well.
And that's why I have a sort of a mission. That's why in the Netherlands, I was the first one who came out of talking about vaginismus, of my own story, and on television, in all kinds of magazines, I tell people about my own vulnerable story. And for me also, it was not easy to do that, but I had only one thing, that nobody has to go the same, really lonely, shameful way as I went. And after I overcome it, then I became a vaginismus specialist, because I'm a counselor in the Netherlands from when I was 19 years old. So I combine my experience, both experience, I combine them. And now I do this for about 15 years. So
oh, wow.
I'm really a specialist now. It's not only about my own experience. And because it's really difficult for people to reach out, I also wrote my book. Marta said I could shout out my book, but it is
a bit. Of course.
I feel a bit because it's so. So I wrote my book, How to Overcome Your Vaginismus, and it's a real book about with all my knowledge and all really detailed knowledge and exercises, and all is underpinned with my own story. And also the stories of the women I coached. It's a step-by-step help plan. And many women overcome the vaginismus by just using the book. But also many women get to know me through the book and think, oh, Jacqueline, maybe she's nice, or maybe I can ask for help with her. Or maybe they can ask somebody else for help, because now in the Netherlands and also all over the world now, because it's translated in English, many people, many counselors use the book for helping other women. So it's really, so all the people helping to let my mission come through.
Oh, that's so nice. Thank you so much for sharing that with us, Jacqueline. And I'm going to get my own copy of the book. That will help me and my clients as well.
Yeah.
Thank you. And maybe when I go to Netherlands, I'll ask you to sign it for me.
Yes, that's really true. People asked me to sign it. I just wrote my name because I didn't know what to do. And then somebody whispered in my ear, maybe you sign with a nice quote or something, because I didn't know what to do, because I'm not really a writer. I just put all my information on paper, and it's become this book.
Thank you. Yeah, we will do that. Even with Dr. Martha, I have her book. And I don't know if you signed it, Martha, but I will go to Singapore and have you sign it. Thank you so much. And I know we also have Katrin here from Canada. Katrin, would you like to share your experience as well as an expert in vaginismus?
Absolutely. And thank you to everybody here who's spreading awareness about vaginismus. I feel like this is invaluable information that unfortunately wasn't available to so many people, so many of us who were experiencing it years ago. And so huge thank you for doing this work in the world. The first thing I want to say to everybody listening who is impacted by vaginismus in one way or another is congratulations for being here. Because the very step of taking action and tuning into this conversation is massive, and it shows, it is actually evidence of your commitment to yourself, to your healing, and your love for yourself, for seeking guidance. And I think that is an incredibly important step that is the foundation of the entire healing journey. My story as a summary is that I also experienced the body response of vaginismus, and I really love calling it the body response as opposed to a dysfunction or a condition or a disease, because it is an empowering way to look at it as an experience that we are currently having, not a disease or a condition that we're at the whim of. And I think this is also a piece that is helpful in just feeling empowered to take action and to retrain our bodies so that we don't perceive penetrative sex as being dangerous. What else would I like to say? It really is a holistic approach. I love what you've been talking about and looking at the pillars of overcoming vaginismus in the steps and the categories of help that are required with psychosexual therapy, physical therapy. And one other aspect that I think is super important that all of you have also touched on is really finding and embracing our authentic sexual selves. Because it's that sense of pleasure and excitement and joy and who am I as a sexual being that actually opens the door to us feeling confident sexually. When I was able to have pain-free penetrative sex, the very first time I experienced that in my own body, I was not there at being a sexually confident vulva owner, like a sex goddess sort of identity that I guide people to discover within themselves. And I realized how important this part of the process is while we're working through the physical aspects, because it itself helps to create the physical relaxation and the pelvic floor muscles. So again, congratulations for being here. And if you'd like to continue this healing journey at your own pace, I invite you to see who you most resonate with as a person, either physically in your area or online, and just follow your heart as to the kind of resources and guidance that you feel is right for you. There are amazing professionals out there, people who've had the similar experience in your life that can help. And this event is just a symbol of that. So you've got this. It is awesome.
Thank you so much, Katrin. That's so inspiring. And you say you got this, because I believe we all have this, and I believe that we're all put together here as experts or people who have experienced these things to be able to help others as well, right? To be able to help them heal as how we healed ourselves, and help them love themselves too, and find their what you said, their own sexual selves. I love it. Thank you so much. But before we go to our Q&A, I would like to ask everyone first if they have something to promote, maybe their social media. Do we have that, Martha? So we're all like connected to each other in some way, because we're doing the same work, right? And we're all over the world. And I believe that the information that we have may be able to help other women as well, not just those who are here. So maybe Dr. Martha, we can start with you. What do you want to share? Okay, Dr. Martha has www.eroscoaching.com. You can find her there. How about your social media? Do you have any? Maybe we can type everything on the chat box. And Hanee, how about you?
To reach out my consultation or any professional services. So actually we have our IG account. You can just follow us at My Vibrance. And we also supply all the education about the pelvic health, not just the vaginismus, all other related issue with Kegel, important of pap smear, Kegel exercise. So everything is there. So just reach out at our IG account.
Thank you. How about you, Ruoshi? Do you want to share?
Yeah, I'm an artist, so my Instagram is likeapoem.art. Like LIKEAPOEM.art. A-R-T. Yes.
Can you put it in the chat, Ruoshi?
I could. Okay. How to type it? Sorry.
It's okay. We'll figure it out in a bit.
Okay.
I saw Jacqueline. Jacqueline, I saw you wrote down where we can follow you or where we can find you. I know you're very famous in that part of the world. So yeah, how can we contact you? Can you share it with us for those who can't see the chat box?
Yes, you can contact me on my through my website, Overcome Your Vaginismus, and also I'm also on the Instagram with Suniva Vaginismus Pain During Sex, and I put all kinds of quotes, information, knowledge on my Instagram, and you can find everything on my my website also, all the links. And if you just set Jacqueline from the build, vaginismus, then everything pops up. Maybe that is the most easiest way. Jacqueline vaginismus.
Oh yeah, we can just Google you. Yes. Yeah, thank you so much, Jacqueline. How about Catherine? Do you have anything that you want to share with us or promote so we can keep in touch?
Sure, yeah, thank you. The best thing that people can do is head over to my website, katrinwithlove.com, and there you can get my free online course of Putting Vaginismus in the Past. It includes my book that I include there as a digital copy for free. And we did a 3-day masterclass recently, about 6 hours of video guidance. That's all in there for you on the emotional healing journey, finding your authentic sexual self, and the physical aspects. My Instagram is pain-free and intimate.
Pain-free and intimate. I love it. Thank you.
I would love to add one more thing as final words of inspiration, if that's okay.
Go ahead. Of course.
I remember laying in my bed on multiple occasions, usually at night after Googling vaginismus for a while and trying to find answers for myself, but also after very painful penetrative sex attempts and feeling like a quote unquote failure, which none of us are, but that feeling is very real. And I remember thinking to myself, like, is this even worth it? Because the pain is so excruciating. It feels like a stabbing knife that has been heated over the fire that is inside of you. And I could not imagine how this could ever be pleasurable. Like, how it is even possible that people enjoy this sort of thing. Why would I ever want to have my partner's penis in my vagina? It's awful. And so what I wanted to say to those who can't quite imagine that it's going to be a beautiful experience is that really it is worth it. It really is worth it. The emotional connection that becomes available when sex has no limitations, the physical connection, the pleasure itself, it is possible and it's worth it. So that's an image, hopefully, that you could hold on to as motivation for your future.
Thank you so much. That's so wonderful and beautiful that it is worth it, even though it's painful now, when you overcome it, and the pleasure that you experience. And not only that, it's you knowing yourself better and you being able to reclaim your body, like what Dr. Martha said. It's all worth it. All right, that's so amazing and that's so beautiful. Oh, before I forget, I also added you all on Instagram. You can also follow me at _ Rica Cruz. So it's _ Rica Cruz. I'm sorry, you when I can't type in the chat box, but I did follow everyone. So yeah, I post pictures of myself though, so and me reclaiming my sexual body. For vaginismus information, you can go to Dr. Martha's, Jacqueline, Catherine's account for that, and of course my Vibrance account. So thank you. And I think now, Yuwen, we invite the questions. Do we have questions on the chat box that we may have missed while we were having the discussion? And anyone
Yes.
can answer. I would also want to invite Jacqueline and Catherine to answer if they feel that they want to. Please feel free to do so. Go ahead, Yuwen.
Yep. So we want to invite everyone to type their questions in the chat box now. If you are shy, you can just text me privately. We do have one private question, which is, how do we help men to be supportive, and what can be done if the man isn't supportive, and or they blame the woman for vaginismus?
Anyone who want to answer that? How do we deal with men who blame their partners for vaginismus, or partners who are not supportive? Dr. Martha, do you have clients who come to you with their partners not supportive? What do you tell them?
Yeah, I have a lot of clients who come with supportive partners, but those without supportive partners who share how they are being blamed. What happens is they end up feeling very defeated and feeling that all the work that they need to do to overcome vaginismus is pointless. They don't see a future where they can proceed to going on to overcoming vaginismus. Like, what's the point? End of the day, this person doesn't want to touch me anyway. This person is angry and blaming and scary. So this does happen, where the partner's reaction actually caused them to be a lot more defeated. And so the support is very, very important.
So it's more, yeah, go ahead.
What I also find out is that the many emotions that also women, but also men are similar. So what I found out is some women told to me that her husband was really angry at her. And when they both come to me, then the man said, yes, Jacqueline, I'm really angry because she allowed to try again without saying that it is really hurtful. And now I'm part of the problem. I make it even worse. And I'm so sort of angry, frustrated, sad, because when she told me that it was really hurtful, of course, I stopped then, even before it hurt, because the only thing I want is to have intimate, lovely, nice intercourse with her. And that is also what I hear many times from men. And the frustration and the loneliness, because they don't share to each other what they are feeling, because both of them, they try to avoid the subject because they think that the other one gets hurt about it. So what I always try to say is, you want both the same thing: lovely, nice, pleasurable intercourse as a part of your whole sexuality, because intercourse is not the sexuality, it's a part of the sexuality. And then they try to talk to each other what they are afraid of, or what they want, or what they feel. And then they become a little bit more closer together, and can share what they are feeling. I think that is also when you find that, when you hear somebody is really angry, just try to explore what he is angry about.
Mm-hmm.
I'd love
So
to
it's
add something also.
go ahead, Katrin.
Yeah, absolutely agree with both of those perspectives. And I love, Jacqueline, what you said, that the partner themselves feels a lot of emotional pain and mental anguish. And the principle I like to come back to here is that hurt people hurt people. And so it is
Mm-hmm.
our own personal wounds that create a place of imbalance energetically and emotionally that then has difficult emotions come up: frustration, blame, anger. Now, this isn't the case at all times, where the emotion comes from a good intention. Sometimes you absolutely have a bad intention, an absolutely abusive relationship, which is not one conducive to creating a safe context for yourself. And sometimes, in some cases, the best option is to find that safety outside of that relationship. Now, that absolutely, that is a possibility. Now, if safety is possible within that relationship, it really does become an exploration and a healing journey together. Often what can help a partner is that they are first educated about the body response of vaginismus, so they feel like they actually understand you. It's so hard for somebody to understand this if they haven't experienced it, but they can get close. And sometimes having a client of mine send my website to a dating prospect, or a husband, even if it's a long-term relationship, so they could read the stories on that website and come to a place of empathy and compassion. That's a really great first step. I've created 3 interviews with male partners, one of which was my partner, to talk about all the intricacies of a relationship and the male's perspective within it. And when the guy or the female partner, whatever gender they are, listen to this interview, there's a lot of light bulbs that go off, because then they realize, oh my goodness, she has been feeling this way. And now she can kind of have an insight into how I'm feeling as well.
And it's not easy to when I was in my process of overcoming vaginismus, to be honest, I was not busy with my friends' emotions. I was just busy in my own head of overcoming it. So when I become to coach, the woman and the men came, and of course, because I'm a counselor, so of course I asked them to all their emotions and their feelings. And then during that time in the beginning, I thought, oh my God, maybe my own friend had the same emotion. And then I talked to him and I said, yes, of course I had. I said, but why didn't you talk about it? He says, yes, you were so full and you were so afraid of everything. So I didn't want to put all my emotion and my thoughts also onto you. And in the meantime, yeah, I talked to him about my coaching, and then we find out how lousy it was that we didn't talk about. We did really well in overcoming it, but not so well in talking about all the emotions we both had.
So it's all about being able to talk about the emotions and being able to give it priority as well during the whole process. And really, I believe that the support is so vital and crucial for people to be able to overcome this. And choosing the right partner, like what Katrin said, can help in the process. Yuwen, do you have any more questions?
So far, we don't have additional questions, but I think the previous one was more on how the men can be supportive in a relationship or marriage.
I've got another tip there as a practical aspect of things on how a man can be supportive. And of course, it is a conversation that involves both people at all times. But one little practical thing that I believe is important is to take penetrative sex off the table until you come to a place of confidence and certainty that you'd like to try it again. And often there is this pressure because in society, us as vulva owners, I believe, are very much givers. We try to give a lot of ourselves, and sometimes this creates behavior of trying to put other people before ourselves as priorities, like pleasing others. And of course, we want to make our partners happy. And so we may give into this pressure and this desire of trying penetrative sex again before we're ready, because we just want it to work so badly, and it's such a natural behavior. But if we try penetrative sex too soon and it hurts again, this only deepens the cycle of pain and creates this exact same psychological response of avoidance and bracing. So it's important to take penetrative sex off the table until you and the professional that you're working with kind of are on the same page that you can go ahead and move on to this next stage of the journey. In the meantime, exploring intimacy, pleasure, sex together with your partner in other ways is incredibly beneficial. There are certain games, certain ones that I've created and teach, of rekindling intimate connection and really finding what your authentic desires, what your likes are, what your dislikes are, what your boundaries are, so that you create a safe context in your own nervous system to feeling like you can actually explore further. And there's a nice little example of how this works in public schools or any sort of schools. If the kids are outside playing in the playground, when there's no fence around the playground, you're going to observe them in a tiny little circle playing all in the same space. But as soon as there's a fence, as soon as there's a boundary and a safe space created for them that they can feel confident in, then they start to explore all the nooks and crannies and corners of the playground. So we want to create the context and the confidence of safety here in rekindling intimate connection with a partner before we move on to penetrative sex.
And what I always tell the people is, especially the men, is that when you do the exercise, and for example, you do the exercise for about 1 millimeter when you are ready to do that, to allow 1 millimeter inside your vagina, then do only 1 millimeter, not 2, not 3, but only 1. So do exactly what the both of you talked about, because when the woman can trust the man about just do the things you talk about, then she can allow herself to relax even more. And at the same time, it's also important for the woman to understand that to go for 1 millimeter inside your vagina, it's really difficult for the man. So you also have to adjust to that and find out, is the man doing you any harm, or is it just 2 millimeter because it's really difficult to do 1 millimeter? So it's at the same time, but the trust, so you can relax and allow a finger go into your vagina, or even later on a penis into your vagina. It's about trusting the other person. And I think many times I say to women, just look at your partner. This is the one who you want to let go into your vagina. It's not the neighbor, it's not something stupid. It's a really lovely man, because not all the women, but most of the women who come to me have really lovely men. So imagine this is this man you're allowing into your body. And then sometimes there became some mind change, because, oh yeah, this is him and I can trust him. And that are all little parts of overcoming your vaginismus. It's just little part by little part you go to do this kind of thing.
Thank you. Hanee? Yeah, go ahead.
Want to add something for men to be helpful, right? So I found that during my rehab session, I found that when when my patient come with the husband, I think the effectiveness of the rehab is more seen compared with my patient that come alone, don't have a support with husband. And I will really like encourage, if the husband is coming with my patient, I will let them join the session. For example, I will teach the husband also to do the perineal massage, to do the dilated training. So I really share with my patient, try to involve your patient in everything that you do at home, even with dilated training, even with just stretching exercise, just let your husband do. Because when you're familiar with your husband, you trust your husband, it's more easier to get more intimacy, get the confidence, that because the aim is actually the husband penis, not our finger, not the therapist finger, but the final goal is actually the penis husband. And that's why we need to utilize the husband. And really like really glad that if the patient have a very supportive husband. So as a therapist, I will really encourage the husband to support and come during the rehab session together.
Thank you so much. So it's really being able to have a supportive partner and encouraging your partner to come with you in treatments. Did that answer your question, Yuwen? I believe that they were able to give out a lot of
Yes, I think that
thoughts and experiences. Yes,
that helped with the question.
Thank you. Do we have any more questions?
Nope, not at the moment. I invite all participants to type their questions in the chat box, or you can send it to me privately.
So are you getting any private messages, Yuwen? that
not at the moment.
all right. Okay, I believe, yeah.
But
I believe
I do have a question, actually, just a quick one.
Oh,
So
okay.
if I have a friend who is facing such an issue, how would it be easier for me as a friend to sort of approach the subject if I really want to help?
Who wants to answer that? It's basically asking how you can help a friend who has
yes.
vaginismus, and how you will be able to tell them, to talk
Can I
to them
answer this?
about it.
Yeah,
Go ahead.
because in Asia, I guess for my friends, it's not always easy to talk about it openly.
Yeah.
So how would be a good way to approach it in a sensitive manner?
Can I answer this question?
Go ahead.
Yeah. Okay. I have some girlfriends who actually experienced this before. So I actually, I think one or two of them, I did recommend them to go to Martha for help. But prior to that, I shared my experience with them. And you just have to really gain their trust and tell them that, hey, I've been through this, so you are not alone. And whatever that you want to know about, I can try to share with you about my experiences. Yeah. And then if they really, have serious, it's really serious to just hear advice from me, then I would definitely ask them to seek advice from from professionals, because for myself, I do not have the opportunity to seek advice from professional. At that time, I didn't know matter. So whenever any girlfriends who approach me at this time, I always let them know my experience and say, hey, right now, there are more and more professionals who can solve this problem. So quickly go and seek help from them. Yeah. And of course, communication with the partner is very, very important. Really have to communicate well with your partner, with and let them know that you want to overcome this, and you are hoping that they are in this journey with you. Yeah.
Okay. I think we
think
have
for
one
me,
more question. Sorry. Okay,
me,
Jacqueline, you can
can
continue.
I also answer your question, Yuwen? For me, my friend, it was my best female friend. I dared to ask her all the questions I could not ask anyone else because I didn't get any answers of them. So when I asked her all kinds of questions, like for example, because I knew that she really enjoyed having sex. So she knew something that I didn't knew. So when I asked her, how can you allow a finger in your vagina? And she told me a little bit. I said, no, I want some details. Can you please explain details? And then she said, yes, I have to go home and try it out to give you some details back because she didn't had at the moment, she didn't thought about it. So then she came back and we talked about the details. And then again, I said, yes, but you do this, but how exactly do you do it? And she is the one, and I'm so grateful that she was in my life. She's the one who helped me overcome my vaginismus with all kinds of details, but also about, for example, I thought that my vagina was a sort of open hole that a finger or a penis can get inside. And many times when I say this kind of thing in the Netherlands, when I teach some other people, then they smile a little bit about me because I said, yes, I did something like this, like sort of this movement. And then when people laugh at me, then I say, if women with vaginismus come to you and tell this and you laugh, then they never go back, never come back. Because I didn't, when my friend told me, yes, Jacqueline, but why do you do this? I said, I have no idea. She said, why don't you go from the part of the clitoris between the inner labia to the vagina opening and then really feel if the vagina opening is a little bit open and just go to that. And I thought, why didn't I thought of that myself? I felt a little bit stupid because I didn't know. And now I hear that kind of story so many times. I was not the only one. But when, as a friend, you can open up and let her know that she can ask all the questions. And even when you think, what a stupid idea what she has. But when you give an answer, the answer that can help her is the key, or maybe a little key to overcome it. And don't underestimate what you can do just by getting relaxed a little bit in her body because she dared to ask you any question. For me, and it was my key, my friend. It was my key. Of course, with my friend and myself also. We both, with the three of us, we did a sort of way, we find out a way to overcome it with her knowledge and what we did about it. But don't underestimate what you can do for your friend.
Thank you. So it's like you plant the seeds
You
for.
plant seeds. More than you know. When you are sweet and lovely, then she can relax a little bit.
Okay, thank you. We do have one last question. What is your advice for older women who experience vaginal dryness due to aging?
Dr. Martha?
Yeah, I would suggest use lubricant, and there are many types of lubricant on the market. There's also moisturizing lubricant, and there are many good products out there that are completely natural. I would suggest looking for organic lubricants, and I would caution against using coconut oil because coconut oil can damage the very sensitive pH level in the vagina. So there's this brand I really like called Sutil from Canada. It's completely natural. You can also look for this brand called intimate organic, intimate earth, used to be called intimate organic, and Silkweed is also another brand that I really like. When you go to the shop, you ask for completely natural products, they will be able to tell you which ones.
And also
Anyone
take some
else?
more time. Also take some more time to get aroused, because I'm now in menopause, and it takes a little bit more time to get aroused, and take that time to get aroused.
Yeah, I wanted to add, both of those are wonderful recommendations. On the topic of lubricant, I did some research and found that the two most important scientific measures to look for are that it is a pH that is very close to the pH of the vaginal flora. I included a blog post there that I wrote on the topic. And another scientific measure is osmolality, so that your lubricant is actually not pulling out moisture from your vaginal flora, and it's not infusing moisture into the vaginal flora that shouldn't be there. So a brand that is beautiful for both of those scientific measures is Good Clean Love, in my opinion. And of course, using water-based lubricant with silicone toys is needed, as opposed to silicone lubricant with silicone. As for arousal, I don't have the experience of vaginal dryness yet in my life, so I can't speak from personal experience. And I imagine that taking that additional time, having that intimate connection be really deep, and allowing that context and the time for your body to be ready is important, because the timing will likely change as our body changes. So we'll just need a little bit more preparation.
Thank you. Anyone else?
There are no more questions. I think we are past the time.
All right. So I believe that what everyone said was very important for everyone to know, especially for women who are experiencing vaginismus. What my takeaways from this panel is that, yeah, we can be able to overcome vaginismus, and basically we can do that by being comfortable with ourselves, having supportive partners, and going to professionals who know exactly what they're doing, so that we won't harm ourselves in the process. And also for us to know that and to trust ourselves that the whole process is worth it, because what we get afterwards is something inexplicable, and it's something that is us. I mean, we own, so we should be able to experience that as well. Sex without pain. Thank you so much to our panelists, and of course, Jacqueline and Katrine, Hanee and Ruoshi, and Dr. Martha and Yuwen for hosting. Thank you very much for joining us in this discussion. And I hope that I get to meet you when the pandemic is over, so that we can work together to help more people and women who experience vaginismus. Thank you.
Yes, thank you, Dr.
Thank you,
Cruz.
Martha.
Thank you all panelists, Katrine and Jacqueline.
Thanks.
Please
Thank
remember
you.
to help us fill in the feedback form. We will send the link in the chat group.